This is me Arzu here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is a part 3 video of the Enamel series, and in this video we will be discussing with the remaining topics of this chapter. So as I have shown in my first video, so this is a content of this chapter, and in this chapter we have covered the physical characteristics, composition of the enamel, ultra-structure of the enamel that was covered in my next video, the second video, rod sheath and inter-rod substances. Similarly, the cross striations, staphylococcus, gnarled enamel, Hunter-Seger band, and the action of rod. So we have covered all those topics, and in this video we will be covering those remaining topics, and the topics are surface structure that include prism-less enamel, pericymata, rod ends, cracks. Similarly, neonatal ring or line, enamel lamellae, enamel tuft, enamel spindle, dental enamel junction, and the edge changes. So let's get started. So our first topic is surface structure. In surface structure there is prism-less enamel. Okay, so prism-less enamel is that enamel that do not have a proper architecture of the rods, of enamel rods. Okay, so they are without the proper architecture. So it is a hypercalcified enamel that is 30 micrometer thick. It is heavily mineralized than the beneath enamel. Okay, so I want to say you that. Okay, so just think that it is a tooth. Okay, so the prism-less enamel are present at the surfaces of the tooth. Okay, they are present at the surfaces of the tooth. I will draw with another pen. Okay, so they are present at the surfaces of the enamel. Okay, surfaces of the tooth. So they are the heavily mineralized and than the beneath enamel. So they are present in a 70% of the permanent teeth and all deciduous teeth. So this point is important, that is to be remembered, that it is present only in the 70% of the permanent teeth and all the deciduous teeth. Okay, and they are present in all the deciduous teeth. Now they are found less often over the cusp tip. Okay, so they are less found at the cusp tip and most common often at the cervical area. The reason behind is this, that at the cusp tip there is an application of the occlusal forces. Okay, so those occlusal forces would cause the decrease in a prism-less enamel at the cusp. Okay, after that I have written here all the apatite crystals are parallel to the one another and perpendicular to the staphylococcus. Okay, so this is to be remembered. So in this prism-less enamel, apatite crystals are parallel with one another but they are perpendicular with the staphylococcus. Okay, next topic is pericymata or the imbrication line. So it is a transverse wave like groove. Okay, that is the external manifestation of the staphylococcus. Okay, and the staphylococcus or the incremental line of radius I have covered it in my previous video. Okay, now it is continuous around the tooth and lie parallel to the each other to the cemento-enamel junction. Okay, so pericymata or the imbrication line, they are continuous around the tooth. Okay, they are continuous. Okay, and lie parallel to each other, so they are parallel with each other. Okay, and to the cemento-enamel junction. So now they are fairly regular, they have fairly regular course, but in a cervical region it may be quite irregular. At cervical region it may be quite irregular. So this point is to be remembered by yourself. It is simple to understand. At cervical region it is quite irregular, but it have fair regular course. Now this point is also important. Okay, so at the cemento-enamel junction there are approximately about 30 pericymata per millimeter. Okay, per millimeter there are 30 pericymata at the cemento-enamel junction, but at the incisal edge, okay, there are 10 pericymata per millimeter. Okay, so from the cemento-enamel junction, when we go upper toward the cusp region, there is decrease in a pericymata or the imbrication line. So this point also we can relate with that point, that at the cuspal or the incisal edge there is application of the masticatory force, so that also there is a less number of the pericymata. Okay, at the cuspal or the incisal edge. Now another next point is our enamel rods end. Okay, so they are simply the ends of the rod. Okay, ends of the rod that are in the outer surface of the crown. Okay, so they are concave and they vary in the depth and the shape. They are shallow at the cervical region. Okay, so they are shallow at the cervical region and deeper at the incisal or the occlusal edge. Okay, so shallow at the cervical region as there is a presence of the shallow enamel rod ends, and at the incisal or the occlusal edge there is a deeper. Okay, deeper rod ends. Now we will study about the cracks, and the cracks simply they are narrow fissure like structure. Okay, they actually they are the outer edge of the lamellae. Okay, so this point wants to tell us that they are actually the external manifestation of the enamel lamellae, and the enamel lamellae I will be dealing with the enamel lamellae later. Okay, but simply understand that cracks are the just the outer edge or the external manifestations of the enamel lamellae. After that, I have written here, ultrastructurally a surface of the enamel appears very uneven. Okay, surface of the enamel, it appears very uneven. There we can see the pits. Okay, we can see the enamel pits there, that is about 1 to 1.5 micrometer in diameter. Okay, and it represents the end of the ameloblast. Okay, ameloblasts end is represented. Okay, here similarly our we can also see the elevations on the enamel surface, and those elevations are about 10 to 15 micrometer. That is due to the enamel deposition on the non-mineralizable debris. Okay, so this is formed due to the enamel deposition on the non-mineralizable debris. As I have discussed in my first video of dental anatomy, okay, there I have discussed about the tubercle. So just you guys would relate both them. Okay, so they are just the enamel deposition on the non-mineralizable debris, and they are the smaller elevations. Okay, but the tubercles are the larger elevations on the crown surface. Okay, now here I have written that if the elevations become the larger, then it is called the enamel brooks. Okay, so you should remember this too. So sometimes they can ask you in viva. After this, we will study about the enamel cuticle. So this enamel cuticle is actually the topic of amelogenesis, but also I have included some points of this enamel cuticle in this chapter too. Okay, so enamel cuticle is also known as Nasmyth's membrane, and that is a delicate membrane. Okay, it is a delicate membrane. It covers the crown of the newly erupted tooth, but are removed further by the mastication. Okay, so in the newly erupted tooth there is a presence of the enamel cuticle. Okay, but after the applications of the regular masticatory forces on the tooth, those enamel cuticle get removed. Okay, and disturbed, so that there is a less so there is absence of enamel cuticle in the older tooths. Okay, typically it is a basal lamina of the epithelium that is apparently secreted by the ameloblast after the completion of the enamel formation. Okay, so when the enamel is formed, okay, so this is a developmental portion. So I will be discussing with the development of every part of the tooth in my another developmental series. But just for now, you guys can remember that they are typically the basal lamina of the epithelium. Okay, epithelium. Think that this is the epithelium and this is a basal lamina or the basement membrane of the epithelium. So typically the enamel cuticle is a basal lamina of epithelium that is apparently secreted by the ameloblast. Ameloblast secrete that basal lamina after the completion of the enamel formation. So just for now, you just remember this. After that, we can see here it protect the surface of the enamel from the resorptive activity of the adjacent vascular tissue prior to the eruption of tooth. So what is the function of the enamel cuticle? So sometime they can ask you in a viva. At that time you can tell that it's simply a protecting structure. Okay, protecting surface, a protecting structure that protect the enamel, okay, from the resorptive activity of the adjacent vascular tissue. Okay, so vascular tissue that are adjacent to the erupting tooth, okay, they contain some cells that are resorptive in nature, so they can do resorption. So to protect those resorption, okay, prior to the eruption of the tooth, there is a presence of the enamel cuticle. Okay, so after that, now we will study about the neonatal ring or the line. Okay, so it is a prominent incremental line. Enamel or the dentin of the teeth develops partly before and partly after the birth. Okay, boundary between two portions of the enamel and the dentin is the neonatal line. So this point wants to tell that simply the neonatal line is that line that demarcates the, okay, the portion of the enamel or the dentin, okay, that is formed before birth, and the portion of the enamel or the dentin that is formed after birth. So as I have written here, they are formed due to the abrupt change in the environment. Okay, and the prenatal enamel or the prenatal dentin is better developed, okay, and due to the adequate supply of the essential materials. But when it get postnatal, okay, but when it becomes a postnatal enamel, it is a less developed, so that there is abrupt change in environment of the tooth that leads to the formation of the neonatal ring or the line. Okay, after that, as we can see here, I have written about the enamel lamellae, and enamel lamellae is also one of the most important topic, okay, of this chapter. So it is actually a hypocalcified structure, okay. So they are a hypocalcified structure. Now they are thin leaf-like structure that extends from the surface towards the dentino-enamel junction, okay, sometimes penetrate into the dentine, okay. So this is a very important point of the enamel lamellae. All of the structure that we are discussing in this chapter, okay, so those structure usually, okay, those structure usually arise from the dentino-enamel junction and move toward the surface, okay, but this is the structure that moves from the surface towards the cemento-enamel junction. So it extends from the surface towards the dentino-enamel junction, and sometimes all it penetrates into the dentine too, okay. Now in the ground section, okay, this point is also important. In ground section it may be confused with the cracks caused by the grinding of the specimen, okay. So during the preparation of the ground section, during the preparation of the slide, it may be confused with the cracks that are caused by the grinding of the specimen, but when we do the careful decalcification of the enamel's ground section, cracks disappear and the enamel lamellae persist, okay. So it shouldn't be mistaken with the cracks, okay. So they persist even after the careful decalcification of the enamel's ground section. After that, I have written here how the enamel lamellae are formed, okay. So they are formed in the planes of the tension, okay. So they are formed in the planes of the tension. This point is important, where at those planes, okay, at those planes, where the rod crosses such plane, that segment of the rod may not be fully calcified, okay. So at those planes of tension, when the rod cross that plane, okay, so if think it is a plane, okay, so when the rod cross this plane, okay, so the portion of, so this is a portion, okay, so this is a portion that is crossing this plane, okay, so that portion or that segment of the rod may not be fully calcified. If it is more severe, if there is more severe disturbance in this plane of tension, then it can lead to the formation of the enamel lamellae, okay. So simply they are those rods that crosses the plane of tension, okay, and remain decalcified, sorry, or remain as a less calcified structure, okay. And we have primarily three types of the enamel lamellae. In the enamel lamellae, there are primarily three types of there are three types. There are type A, type B, and type C. Type A means they are poorly calcified enamel rod is present in a type A, and it restricts to the enamel, okay. So type A enamel lamellae is such a type that is restricted in enamel itself, okay, and it contains poorly calcified enamel rods, okay. As it is restricted in enamel itself, the content of this enamel lamellae should contain the content that is present in the enamel, and that is enamel rod, okay. So easy to remember this: poorly calcified enamel rods and restricted to the enamel, okay. After that, in type B, we can see here there is a presence of the degenerated cells in the degenerated cells and may extend to the dentine, okay. So there is a presence, okay, the content of type B enamel lamellae is degenerated cell. It constitutes of the degenerated cell, and it may extend to the dentine, okay. It may extend to the dentine. And also I have written here it is present in an unerupted tooth, okay. So as the teeth is unerupted, okay, it is not familiar with the outer environment. It is just in the gums of the tooth, okay, gum pad of the tooth, gum pad of the, so it is just in a gum, okay. So it contains the degenerated cells and may extend to the dentine, okay. So just you remember this. After that, I have written here the type C. So type C, it is present in a erupted tooth, okay. It is present in a erupted tooth, and it is more common and extend to the dentine. So type B and type C can extend into the dentine, but type A do not extend to the dentine. And it constitutes of the organic matter presumably the derived from the saliva. As it is erupted, it is familiar with the external environment, and it constitutes the organic matter presumably derived from the saliva, okay. Now it is suggested that enamel lamellae may be site of the weakness in the tooth and may form a road to entry for the bacteria that initiate the caries, okay. So it is an important point, okay. So this point wants to tell us that simply, okay, I will draw one picture here. Think this is a tooth, okay, and this is an enamel lamella that is extending from the surface towards the dentino-enamel junction, and their external manifestation is the crack, as I have discussed earlier. So from those cracks, okay, bacteria can enter inside the tooth, okay. So that's those bacteria that can enter inside this enamel can cause the caries, okay. So they can initiate the caries. So they are the most important structures that are fertile, that cause the proper road, okay, for the entry of the bacteria. Okay, after that, this is two important point. Okay, so they can ask you in a viva, okay, what is the significance of the enamel lamellae. So at that time you should tell this. After that, we will study about the enamel tufts. Okay, so enamel tufts are simply the ribbon like structure. Okay, so they are the ribbon like structure and hypocalcified structure. Okay, they are hypocalcified structure as the enamel lamellae, and they project from the dentin enamel junction to the thickness of 1/5 or to the 1/3 of the thickness of the enamel. Okay, in thick section, they arise from the different planes and are projected to one plane, giving the appearance of the tuft of the grass. So name of the enamel tuft. Okay, so in a thick section, okay, the enamel rod, they arise from the different planes. Okay, so they are arising from the different planes. Okay, they are arising from the different planes. They are arising from the different planes, giving, okay, giving the appearance. Okay, giving the appearance of the tuft of a grass. So we can see that it is quite similar with the tuft of a grass. Okay, so that it is named enamel tuft. Okay, so there is greater amount of the enamel protein present. Okay, so this point is very important. At enamel tuft, okay, there is greater amount of the enamel protein present. A special protein called tuft protein has been reported at those sites. Okay, so tuft protein, okay, has been reported at those sites. Now they extend greatly in the direction of the long axis of the crown, so they are abundantly seen in the horizontal section than the longitudinal section. So this also applies to, okay, so this also applies for the enamel lamellae. Okay, this also applies for the enamel lamellae, that it extends greatly in the direction and the long axis of the crown. Okay, so that they are abundantly seen in the horizontal section than the longitudinal section. Okay, after that, in scanning electron microscope, it revealed that enamel tuft to be tubular in structure. Okay, so it is when we see this enamel tuft in scanning electron microscope, it appears as a tubular structure with a cross striations. Okay, similar to the rods of enamel rod, and plate-like structure is present at the center of the tuft that is originating from the superficial layer of the dentin. Okay, so this is to be remembered. Okay, so in scanning electron microscope, when we see the enamel tuft, it appears as a tube-like structure, okay, with the cross striations. Cross striations are present in that, and the plates-like structure. Okay, so plate-like structure is present at the center of the tuft. Okay, that is originating from the superficial layer of the dentin. Okay, superficial layer of the dentin. Okay, after that, enamel tuft, we will study about the enamel spindle, and similar as like the enamel lamellae, enamel tuft, enamel spindle is also a hypocalcified structure, spindle in shape. Okay, so simply enamel spindle, they are odontoblastic processes. Okay, they are odontoblastic processes that crosses the dentino enamel junction and extend into the enamel. Okay, so if this is a dentino enamel junction, this is a dentino enamel junction, so there are odontoblastic processes. Okay, we will be discussing these odontoblastic processes in detail in dentin chapter. Okay, but for now, the odontoblastic processes that are tubular in structure are odontoblastic processes. Okay, they are present in the dentin, and sometimes these odontoblastic processes extend into the enamel. Okay, they can extend into the enamel. Okay, they can extend into the enamel. So this extension of odontoblastic processes in the enamel by crossing the dentino enamel junction is called enamel spindle. After that, here I have written it is a direction of the odontoblast processes and the spindle in the enamel that correspond to the original direction of the ameloblast at right angle. Okay, which is right angle to the surface of the dentin. So the direction of enamel spindle is simply the direction of the odontoblast, as it is the extension of the odontoblast, and it is spindle in enamel. Okay, that is corresponding to the original direction of the, okay, which corresponds to the original direction of the ameloblast, and that is normally right angle to the surface of the dentin. Okay, so it is right angle to the surface of the dentin. Okay, it is also right angle, it is also right angle. Okay, I'll show you on the plane. Okay, so this is a right angle. Okay, so this is also right angle, this is also right angle to the dentin, this is also at right angle to the dentin. Okay, now in another point, as we can see here, it is found mainly at the cusp tip. Okay, so you can remember this enamel spindle, similarly the gnarled enamel. Okay, so they are found at the cusp of the tooth. Okay, whereas this enamel lamellae, enamel tuft, okay, they are found at they are not specific to the cusp of the tooth and found everywhere in the tooth, but this enamel spindle are particularly found mainly at the cusp tip. Okay, now it contains small needle like crystals of about 70 nanometer in a length and about 5 nanometer in the width, or granular and or amorphous. Okay, so it may contain a small needle like crystals. Okay, that may be it may contain small needle like crystals, or also contain a granular like structures or amorphous structures. Okay, so if it contain the crystals, the dimension of the crystals would be 70 nanometer in a length and about the 5 nanometer in the width. Okay, after that we will study about the dentino-enamel junction. So as the name suggests, okay, it is a junction between the dentin and the enamel. Okay, as this is a junction between these two sides of the paper. Similarly, dentino-enamel junction is a junction between the enamel and the dentin. Okay, so it's a junction between the enamel and the dentin, and it is a surface of the dentin at the dentino-enamel junction, which is pitted. Okay, so simply this junction is pitted. Okay, this is pitted like this. Now in the shallow depression of the dentin fit rounded projection of the enamel, which assure the firm hold of the enamel cap on the dentin. Convexity is towards the dentin. So this point is important here, and I will explain it properly. Okay, so just think this is a enamel surface, and as I have, and this is a dentino-enamel junction. So dentino-enamel junction. Okay, so this is a dentino-enamel junction. Okay, and it is like pitted, but in previous picture I have just drawn straight line for easy explanation, but the topic is here dentino-enamel junction, so I have drawn like this. Okay, so dentino-enamel junction is like this. Okay, they are pitted with the convexity is towards the dentin and the concavity is towards the enamel, and this in concavity there is a rounded projection. Okay, rounded projections of the enamel, okay, get entered into that. I think this is a pitted like structure, and here the enamel is entering. Okay, enamel spherical projections of the enamel entered at those concave portions of the dentino-enamel junction. Okay, and this cause the firm hold of the enamel cap on the dentin. Okay, and okay, so it is easy to understand. Now dentino-enamel, don't get confused. Okay, it is always like this, but some people will get confused. It appears like this. Okay, so always think that convexity is towards the dentin, no, and concavity is towards the enamel. Okay, never be confused with this. Okay, this is mistake and this is correct. Okay, so it is never like this, it is like this. Okay, concavity towards the enamel and the convexity is towards the dentin. I am repeating it so many times so you guys can remember it easily. After that, dentino-enamel junction, it is a series of the ridges, okay, which is more pronounced as the occlusal area. To further, it is a like a, okay, it is a adaptation. Okay, it is a adaptation process. So at the masticatory point, okay, at the cusp point, when there is a large amount of the force, okay, so those force would cause the ridges of the dentino-enamel junction to be pronounced more for resisting those forces. Okay, so it is matter of adaptation. Now it is a first hard tissue that is in first hard tissue interface to develop. Okay, so it is a, you can remember this is the first hard tissue to be developed, so they can ask you in the viva. Okay, there is also a cemento-enamel junction. Okay, but the dentino-enamel junction is the first hard tissue interface to develop. Okay, now it is preformed even before the development of the hard tissue. Hard tissue, when it is not formed, before it there is development of the dentino-enamel junction. After that, our last topic of this chapter, that is edge changes. Okay, so in the edge changes, as I have written in points. Okay, so due to the there is a presence of adhesion of the occlusal surface and the proximal contact point. Okay, as a result of the mastication, that caused the flattening of the proximal contour and the loss of the vertical dimension of the crown. Okay, so okay, there is adhesion of the occlusal surface and the proximal surface. Okay, that would cause the flattening of the proximal contour and the loss of the vertical dimension of the crown. Okay, it is easy to understand. After that, there is a loss of perikymata in newly erupted tooth. It is in more number, but in after the time, after a few years, okay, there is a loss of the perikymata. Similarly, there is disappearance of the mamelons. Okay, in a newly erupted tooth, there is a rounded projection. Okay, there is a rounded projection present on the, okay, incisors. Okay, central incisors, so they are disappeared in the older tooth. Similarly, there is an increased uptake of the fluoride ion. So this point is important. Okay, there is an increased uptake of the fluoride ion. Okay, due to which there is also okay, there is also reduced permeability between the crystals, become bigger with the ion adsorption resistance to the decay. Okay, so there is increased uptake of fluoride ion also. Okay, and also other ions too, and that causes the decrease in permeability. So as the permeability decreases, it causes the resistance to the decay may be increased. Okay, so for decaying, okay, the resistance that resists the decay of the tooth is increased in the older tooth, but in new tooth it is more susceptible to the caries. Okay, So this point is very important. Okay, after that I have written here the loss of enamel caps, enamel brocks, and enamel pits, and I have discussed with all those points in earlier. Okay, so enamel brocks are the larger elevation, enamel pits are the pit like structure. Okay, so it is easy to understand. Okay, so as we have covered all the topics of this enamel series. Okay, so once you go through the all those videos, okay, so part 1 video, part 2, and part 3 of this enamel, now you can go and study the notes of this chapter and revise properly. Okay, so the every point what that I have told in these videos in this enamel series are too important. Okay, if you know this much, okay, it is more than enough. Okay, and for today's, okay, I have missed to show you pictures, so I will show you pictures of those. Okay, so I will take few minutes. Okay, so as here, okay, staph radius as we discussed earlierly. Okay, here is the neonatal ring. Okay, so it is a neonatal ring. Okay, dental enamel junction is present here, and this pronounced staph radius, so these are the staph radius, and this is a pronounced staph radius, that is a neonatal ring. Okay, and this is a postnatal enamel, and this is a prenatal enamel. Okay, it is also extending towards the dentin too. Okay, sometimes. Okay, and also may be present only in enamel too. There is not, so there is not any hard and fast rule. Okay, so it is a postnatal enamel, this is a prenatal enamel. So here in this picture, as we can see, that there is an enamel lamella and enamel tufts. Okay, so this grass like appearance, okay, grass like appearance, this is enamel tuft, and in enamel, okay, there we can see this okay, crack like. Okay, so they are enamel lamellae. Okay, spindle shaped. Okay, they are quite of spindle shaped, and external manifestation is crack. Okay, so there is crack. Okay, and this is a dentin enamel junction, so it is easy to understand now. Okay, here is enamel spindle. Okay, so they are present at the cusp tip. Okay, so they are present at the cusp tip, and this is a enamel spindle. Okay, okay, so enamel lamellae, sorry, I have told. Okay, it is presented from the surface towards the dental enamel junction. Okay, so here is enamel spindle, which is of spindle shaped. Okay, and it extends from the dental enamel junction towards the outer surface. Okay, okay, so as I think I have covered all those points. Okay, so now this much for today. If you love this video and this series, please do like, subscribe, and share with your batchmates, and uh, I will catch you in the next video. Till then, tata, bye bye, stay happy, stay healthy, and study hard. Thank you.